Hello and welcome to AI Amplified, Healthcare AI Discussions with Dr. Heather Bassett. AI is here, it's real, and it's making a major impact. Dr. Heather Bassett is Chief Medical Officer at Exelis and is at the forefront of innovation, cutting through the noise with other industry leaders who are making a real impact in the world of healthcare AI. AI Amplified is brought to you by Exelis, an AI-driven healthcare technology company transforming the payer-provider dynamic. Let's give a warm welcome to healthcare industry champion and our host, Dr. Heather Bassett.
Welcome, everyone, to AI Amplified. I'm really excited to welcome our guest today, Dr. Stephanie Lahr. Stephanie and I have known each other for over 20 years. We both went to medical school together at the University of Texas Medical Branch in Galveston, Texas. You literally could either find us in the coffee shop where we would study or at the gym. I think that's both of ours, stress reliever. But Dr. Stephanie Lahr is a nationally recognized leader at the intersection of clinical care, healthcare technology, and digital innovation. She has over 2 decades of experience spanning hospital medicine, health system executive leadership, and health tech entrepreneurship. Dr. Lahr brings a rare blend of medical expertise, operational strategy, and visionary thinking to the industry. And she was recently included on Becker's healthcare list of 100 women to know in health IT. So welcome, Stephanie.
Thank you, Heather. And you were on that list too. So let's don't forget that.
Yeah.
But as I hear you sort of recounting our history, in some ways it feels like it's been 20 years. How can that be? And then in other times it seems like that was a lifetime ago. So it's so fun to kind of see how our careers have evolved and to stay in touch.
Yeah, and I mean, definitely fond memories of that experience. But so speaking about, since we've known each other since medical school, let's kind of start at the beginning. I don't think either of us had a healthcare AI executive on our med school career bingo card. So how did your journey from med school to CMIO to CIO to AI healthcare executive transform?
Yeah, no, it's funny you say that. I'm at a meeting with a number of other physician CMIO leaders, and I said if somebody had asked me in medical school, like, hey, maybe someday you'll be a CIO at a health system, first I probably would have said, what is that?
Yeah.
And the next thing I would have said is, oh, definitely not. And yet, here we are. It's interesting. Galveston and my time at UTMB as a resident actually played a pretty significant role in the evolution of my career moving into informatics. We went live with Epic actually during my residency relatively early on. And then in 2008, Hurricane Ike came through and was pretty devastating to the island, to the university. It was, we were closed on the property in Galveston for many, many months. I was just about finished with my residency, and so a couple weeks after the storm, where I had 5 feet of water in my own house, so I was kind of displaced and trying to figure out what to do. The leadership of my program said, "Hey, we have a bunch of patients who need help. We're gonna stick you in an office I was on the mainland in Texas City in like a strip mall and in a room. I'm not even sure it had any windows, but they gave me a computer, a fax machine, and a phone and said, take care of people. Like, let's get people back on track. But because of our transition to at least a digital platform, I had electronically available records. I could see what had transpired, hospitalizations and notes. I could actually send prescriptions and get information sent to other entities. And it was a pretty powerful experience in realizing the opportunity for what that could do and what then the future opportunity could look like by leveraging that further. That in our previous paper world was, I mean, literally drenched in water just a few miles away. So it was a pretty interesting career shift because I was supposed to stay for a chief year and do a fellowship in palliative care and decided that there was just too much kind of happening at the time and decided to go into private practice as a hospitalist and moved to Coeur d'Alene, Idaho, closer to where I grew up in Montana and definitely out of hurricane territory. And I remember meeting with the CEO of the health system and was asking, I said, hey, so, what are you doing for EHR? What's the health system's plan here? And he paused and he kind of looked at me and he was like, well, just to be clear, are you saying you're a doctor who wants to use an EHR? And I said, I mean, again, this is 2008. And I said, well, I mean, they're not the most amazing tool ever, but it feels like they're far superior to what we've been doing. And so, yes. And he was like, well, do you think you might be willing to be involved in our organization's, transition? They were getting ready to upgrade to another system. And I thought, "Well, yeah, probably. I mean, like, better to be included than sit on the outside." So I just sort of jumped in. And then, kind of fast forward, I found there was this whole clinical informatics subspecialty. So I went through that process and got board certified in clinical informatics and was doing, CMIO work. Then I got recruited over to Monument to be their CMIO and roll out Epic. And I was reporting to the CIO at the time, and he was getting ready to retire. And the CEO of the health system came to me and said, given the depth of interaction between technology and healthcare delivery, maybe it makes sense for a doctor to lead our technology teams. Would you be willing to be our CIO? And I was like, well, I mean, I've never done it before, but yeah, that sounds amazing. I'd love to try something new and do it differently. So I jumped in, surrounded myself with a network of, CIO colleagues around, that had other technical expertise or had large budgets and, things like that before, because those were all new elements. And then also was really able to find my way into the innovation space, because now I was the one sitting at the senior executive table talking about strategy and where technology could take us. The budgets were mine, the teams were mine. And so figuring out and then going out and identifying the cool technologies that we could bring beyond the traditional basics that we needed with, EHR, ERP packs and those kinds of things. And so, that kind of carried me through into this innovative, CIO role. And I was doing lots of speaking and, different things like that. Because at the time I was one of really a handful of physician CIOs in the country. And then I met Andrew, who is the CEO and founder of Artisight and a physician anesthesiologist, and was so excited about this concept that I had just not even been able to think of at this point, which was, let's use ambient-based sensor technologies with computer vision and natural language processing and ultra wideband sensors, and let's basically emulate human senses and then figure out how we leverage that emulation to reduce friction, right, for clinicians and take off the stuff that they just don't want to be doing and the data capture that they, aren't even good at doing. And so was really excited, got involved at first as a customer. And then he came to me later and said, you seem real excited about this. Maybe you want to come and work for me. And I thought, well, I've, never done that before, but that sounds amazing. So once again, kind of decided to make a jump into something I was feeling passionate about, and have spent the last 2.5 years at Artisight helping to grow their commercial division, putting together sales and marketing and messaging and doing thought leadership, building teams around that, helping establish, customer success. At the time I joined, we had about 3 customers, and they're over 25 now and in thousands of beds across the country. So a really exciting time to be a part of that growth, and was able to learn a tremendous amount about the business side of, technology delivery, and even the venture side, and the investment side of all that. And then realized that, in some ways I had sort of worked my way out of a job, right? Because I built a bunch of stuff and then was handing it off to other people. And that's what I am really good at, right? I love the building, the transformation, the helping push the envelope on what's next. And so decided a handful of months ago that it was time to think about what that next step was going to look like. And then about a month ago, I posted, cryptically on LinkedIn that I was leaving Artisight and going to go take some time for family, which I did. And now just recently back, and sort of hot off the press, I guess, is the announcement that I have started my own company. And so Vital Thread Advisory is a way for me to bring together, some of those attributes and collection of my experiences that you were mentioning in the intro at the beginning, and help more than one group at a time. So that's the whirlwind tour of how I got from our med school classes to where we are today.
No, that's an amazing story, and I think you touch on a couple of key things. And I mean, obviously, I'm a little biased as a physician as well, but I think we really do bring a unique voice to the table when it comes to innovation, when it comes to, we're both pretty passionate about artificial intelligence, but kind of having that, having kind of worked in the trenches, so to speak, you having that ability to understand the problems that you're trying to solve, and then layer in the tech piece of it. I think there's a unique space that we sit in and occupy that really brings value. And if you go to your LinkedIn page, you say that you're dedicated to bringing the joy back in medicine and reducing friction. So, particularly with your new venture in mind, or, even, when you're working at Artisite, what are some of the biggest problems in healthcare you're most passionate about solving?
Yeah, it really is this degree of friction and burnout on the clinical side. That's in many ways a result of the work that I was doing as a
Mhm.
CMIO, right? I mean, honestly, there were times as a CMIO where I felt like, my if I was putting up a banner board out somewhere, it'd be like, I can make it suck less,
Yep.
right? Which I don't know. Is that really billboard worthy? But I mean, it was also honest, right? Like some of this was just it was well intended, and the outcomes of what we were trying to drive were right, but the execution and the deployment and the usability were wrong. And we're at a point now where we want to consume, and then we'll have an ability to analyze and leverage massive volumes of data. So we're as data hungry as we've ever been. And yet, historically, the challenge has been we've always collected data on the backs of humans. And to me, that is just, it's both philosophically wrong and logistically incorrect. We as humans are not good at data entry, let alone when we are a clinician who is really wanting to be focused on delivering high quality care. Those things become almost at odds with each other. And so a lot of my focus when I was a CIO and things I was going out and looking for, a lot of my excitement and going to work with Artisite and a lot of the companies I'm working with now are centered around this idea of, okay, we've got our basics in place. We've had our EMRs or ERPs, all those things. Now, how do we layer some things on top of that allow our clinicians to be clinicians? And in other areas as well, how do we leverage our revenue cycle teams to be focused on, revenue generation and capture and things, not the intricacies of coding and chart
Mhm.
extraction and capture, like things that technology is actually better at than we are, and that is systematically burning us out and causing us to leave our areas of specialization.
Oh, I know it's kind of crazy what we expect to, whether they're physicians, nurses, or they're more administrative staff, like in Rev Cycle, with the amount of data that's in the EMR, that we ask them to consume and generate an output that is then supposed to drive an action. So yeah, I completely agree that better ways to manage that data, layer artificial intelligence on top of it, and be thoughtful about the way that it's rolled out from a change management standpoint is really what's going to your point, kind of bring the joy back in medicine. And I think also I'm sure you bring this perspective as well, because you've worked on both the health system side and the vendor side. So kind of having sat on both sides of the fence, are there kind of some areas of advice that you would give either side, I guess, on things they should think about that they may not understand, not knowing the other side perspective?
Yeah, I think during the time that I was the CIO, we there was already a movement toward vendor collaboration and that there was partnership and it was less about transactional. The CIO role itself was less transactional. So the expectations of what the CIO was going to get from the vendor became less transactional and again, more partnership oriented. What I think is really important right now is that as we think about where AI is going to take us moving forward, the reality is the average health system, save some of the highly academic and research-oriented organizations that will produce some amazing AI-based technologies. But the average, community-based health system is not going to be in a position to create the tools that are necessary to support the work that they need to do from an AI perspective. On the flip side, the vendors, the technologists, the software developers are not going to be in a position to be able to create the specificity and accuracy and the data that is needed in order to build their models and have them work effectively without the health system. And so I think that both sides really need to be thinking about what does real partnership between health systems and vendors look like, leveraging the best of both. Because for AI tools to be really effective in healthcare environments, they have to be trained on healthcare data. They
Mhm.
have to be built within the concepts of how a health system works. And the best way for that to happen is the vendor team to work inside almost of a health system and collaborate on building and bringing those pieces together. So I encourage then on both of those sides for the leaders of those organizations to think creatively about how they can get involved in those spaces because once it's built, that's fine. And then yes, the next health system will be able to just go buy it and bring it in. But as we think about what tools are, we're going to want to see, somebody's going to have to raise their hand at the health system side and say, yes, we will be project, number one, we will be your incubation team. Because without that, we're never going to get to the degree of accuracy and precision of the, performance of these AI algorithms that we need.
Yeah. No, I love that talking about the partnership because I do think that is key between the health systems and the vendors. And to your point, even if it's that, kind of incubation stage where, like you have a health system calling to their trusted, vendor of like, can you help us with this problem? But I also think it does continue after that. We're pretty big believers of that here at Exelis of continuing that partnership. So ensuring that I think a lot of people still don't trust AI. So just making sure that they really understand the value and that change management piece, and then continuing to provide additional value and again to that incubator point of like what is the next problem we need to solve for you so that you can continue to provide great care for the patients at the end of the day.
Yeah, and I would add, along those lines, I think a piece that the vendor side can do is actually try and help provide some education, not necessarily about specifically your product, but help health system leaders understand how some of these tools work. Put on a master class about
Mhm.
LLMs,
Mhm.
or even not even, maybe it's not a master class, maybe it's just a preliminary 101 class. But people on the health system side are grappling right now with how do we, especially if you're not a research and education based organization, where do you go to
Mhm.
help your leaders understand how these tools work, when to think about using them to help reduce some of the fear and the mistrust of what these tools are capable of. Because some of that is rooted in just a lack of knowledge. And as these health systems are looking at putting governance structures together, well, you can't very well put a governance structure together if you have no idea what the underpinnings of the technology really is doing. And so I would encourage vendors who have these deeply technical, brilliant minds on their team with lots of knowledge to see if you can find ways in giving back to come up with just, ways to be able to provide education and knowledge. One, it makes the selling easier, right? Because now you're more, that's a more trusted tool. But more than anything, it's rising all the boats. As everyone knows and understands and trusts more, we can move the conversation away from if and when to how and what.
Yeah. So are there kind of continuing on that theme just a little bit, what are some of the lessons learned, that you would give folks? Because, obviously you've been involved in implementing on the health provider side, as well as, as from a vendor standpoint, speaking with hospitals and rolling out a product that's new to them.
Yeah. I think one of the pieces is to start small, but
Mhm.
start, right? So I think not allowing the sort of fear of what's out there, and where it may go prevent you from getting started. I think, when it comes to AI tools, there are clinicians have a tendency to immediately think about making clinical decisions for me, right? You're going to tell me this is the diagnosis and this is the treatment, and what if you're wrong, right? There's a huge amount of opportunity on efficiency gains and optimization of workflow that can happen way before we have to get to the point of making a recommendation on diagnosis and other kind of clinical decision support. Those things are going to be vitally important and will actually help as we move forward. Because as you mentioned, like there's massive amounts of information out there, even in our own EHRs, let alone the literature and the evolving science of medicine. So those pieces will come, but there's a lot of opportunity before that that's a little bit lower stakes, where people can start to drive this. On the vendor side, I would say health systems are looking for value, for a return on investment. I do think that it is appropriate to push health systems to think differently about AI investments. They're not, I actually, Anthony Chang was here at this meeting that I'm at and was speaking yesterday. And he said, this is something that he really harps on, is that it's not linear. The investment that you're making in AI is not going to have a linear return. And so many of the things that we've thought about in the past, our EHRs, our ERPs, it's a sort of linear over time. This is, these things are going to go away and these things are going to get better. There's more of a slow uptick and then an exponential opportunity for what AI does, just because of how those tools work. And so I think we, again, need to help our health system leaders, CFOs and others, understand that their traditional perspective on assessing ROI probably needs a bit of a tweak, in order to really understand kind of the value proposition. But on the vendor side, you've got to be able to align the tool set that you're bringing to bear with not only a problem that needs to be solved, but something that generates value, typically a financial value of some kind, because the money to pay for these tools has to come from somewhere.
Yeah. So tell me, you kind of teased a little bit about your new venture with Vital Thread Advisory, and clearly, you have a lot of experience in different areas, and everything that you've spoken about today. I mean, there's so many paths you could go down from an advisory standpoint. How are you how do you see this rolling out and providing support for your clients?
Yeah, well, in the whole 1 month
Yeah.
that I've been, because it's sort of incubating this, um, uh, I think, I've worked with companies. I was the CIO and CMIO who worked really closely with vendor partners. At the organization that I was at, we didn't have the biggest budgets, but I could make myself important to those vendors in other ways, right? By providing them feedback, by providing them thought leadership, by a variety of different things. And so, I bringing the thoughts together, kind of how that came to be, and then conversations with them, a number of them at times said, wow, given all these different things you've done, it would be great to have somebody like you on board, but I don't know if, we need you all the time. And the reality is, I mean, there's so much great stuff happening in the technology sector right now, whether that's companies who've been in the space for a long time but are now building new tools, or whether that's brand new startups that have amazing ideas and technology and looking for their way in. And so, what I thought was, what if there is a way for me to be able to take that blended experience that I have and work with cool companies with cool technology who really have something to offer the broader community, and that my experience could help move them forward, but not necessarily all of me all the time. And then there's also this sort of synergistic effect of the conversations and things that I'm learning from working with one company can actually help benefit some of the work I'm doing with another company, whether that's through a marketing strategy or whether that's through learning about some new regulatory something that came out,
Mhm.
just whatever it could be. This ability to kind of have exposure to a number of different companies allows me to both help them, but help others through helping them. And so I don't know. I mean, it's new, but I will say, relatively quickly, I had a number of companies who jumped in and said, yes, this seems like a fabulous idea. It is, you mentioned earlier, having physicians involved
Mhm.
in these pieces is really critical. And yet the average physician that's in a CMIO role or something like that is not going to be in a position to take a 25% job as a chief medical officer for a
Oh,
vendor,
yeah,
right?
yeah.
And so how does that company who needs a chief medical officer 20, 25, 30% of the time, where do they go to find them? Because most people aren't looking for 30% work. And so I thought, well, maybe I can do that. Maybe
Mhm.
and so yeah, we'll see.
Yeah. So last question for you. As you know, there's a tremendous amount of buzz in the industry these days. In 2023, Chat GPT and generative AI kind of started the buzz, and now we're hearing a lot about agentic AI. What are your thoughts on kind of all of these? How quickly there's innovation in this space, just how quickly things are changing. I mean, it's almost impossible to keep up with it these days. What are your thoughts on just the pace at which AI is moving, and how healthcare can keep up with that?
Yeah, probably what makes me the most nervous is our ability to keep up with it.
Yeah.
Because it is moving so fast, and there's no sign that curve itself is going to taper off anytime soon. So I guess I think, it's a really exciting time. I'm
Mhm.
not even sure that we are excited enough
Mhm.
about what the opportunity that's out there. And I hope that people are really creative right now in thinking about, how to get involved in this. I think every person should be using some sort of, LLM based something
Mhm.
in their own lives, just to help gain an understanding of, oh, that seems like, that's a weird response. I don't know why I got
Mhm.
that. Learning how to write prompts, just little things. If you're doing them in your own life, it helps bring them into other spots, and bring them into your work life in a different way. But I'm really just very, very excited. I think, there will be some pitfalls, and we're gonna probably fall down in a couple of spaces. I think knowing that and trying to be as conscientious as we can going in is helpful. But more than anything, I'm just really excited about what's to come.
Oh yeah, I completely agree. I'm pretty excited as well, and that's fantastic advice. And I agree that everyone really should get out there, get on Chat GPT, get on your favorite LLM, and just start to understand what's coming, so you can be part of the conversation. But really wanted to thank you so much for joining me today, Stephanie. This has been awesome catching up. I wish you the best of luck with your new venture. Can't wait to hear more about that. You can stay in touch with Dr. Stephanie Lahr by connecting with her on LinkedIn or click through the links in the show notes. Thank you for listening and joining us today. Until next time, I'm Dr. Heather Bassett.
Thanks for listening to AI Amplified. Tune in to the Healthcare Now Radio Podcast Network for more episodes like the one you heard today. To learn more about Exelis, visit our website at exelis.com. That's XSOLIS.com. You can also follow Exelis on LinkedIn, Facebook, and X. Dr. Bassett would love to connect with you. Join the dialogue on her LinkedIn, where you'll find her at Heather Bassett, MD. Let's keep the conversation going.